We're here today to talk about hormones, what questions people have, and I definitely, please ask the questions you have down in the comments. But today we're going to talk about some things, answer some questions. Let's do it. What questions, what things do you have to say, Rachel?
Who would think that in your 40s you could be
Perimenopausal.
perimenopausal, but I experienced that in my 40s, and my doctor was kind enough to start me just on a hormone patch. But the hormones that we have here have changed my life. They have brought me clarity, good sleep at night, no more hot flashes. I just feel more energized and excited, and I just kind of feel like myself again. So I couldn't thank you enough for just transitioning me into getting pelleted with the right amount of hormones that, we test our levels and make it just right for you. It'll just be custom for what your body needs. So it was a game changer for me, that's for sure.
That's that testosterone.
Yes.
I'll tell you what, life is so much better with testosterone. Because, in perimenopause, estrogen levels, progesterone, they fluctuate up and down all the time. Testosterone's pretty much on a, and testosterone is what gives you that drive to get out of bed in the morning, the drive to get into bed at night.
Yes.
All the things that you might want to do. So it's just like amazing. And perimenopause is such a time of life. Oh my gosh. It's crazy.
Yeah.
So you and your perimenopause story? No, you don't have that story.
Well, I agree with everything she said, but as a man, as a guy, the libido was insane. I mean, I'm 50, and I did not think I would feel the same way I felt when I was in my 20s. I'm like, what is going on? Which was really, actually, it's really insane. It's amazing. But the other thing is that, what I really like is that the whole process before we got into that. So do you remember when we started pelleting and then my PSA values went up and you're like, nope, we need to stop. Let's go ahead and see a specialist. And we went to a urologist and he gave me the okay. Everything was fine. It was just I naturally have a high elevated PSA values. And he goes, that happens with some guys. Not everybody, but it does happen. And then we went on from there and just continued the therapy. So that's why I really like working with Amanda. Because everything's tailored to you. People are different. And that's why I just love that she looks at my blood work and looks at the data and is like, okay, this is what we need to do for you. And single thing that we've done so far has been just amazing.
That is so exciting to hear. And, that is a really valid point. A lot of people do worry about prostate cancer, breast cancer. There's risks with life.
Right.
That's just how it goes. But doing bioidentical hormones does not innately increase your risk of cancer. So we do look for markers though, because I obviously don't want you to have prostate cancer. PSA is a marker that shows us if the prostate is inflamed, which often can mean that cancer could be setting in because cancer is inflammatory. But PSAs can also be elevated for many, many reasons. And so Rakan is an example of that, where it's elevated for, not a cancerous reason, just another reason, and that is okay. But it's always important. That's why I like to work. I have a network of people that I consult with to ensure that our patients' safety always is the very highest priority. So that is so exciting. Okay, no prostate for you, no perimenopause, right?
No,
okay.
No, as a woman who's been postmenopausal for 8 years and a breast cancer survivor, again, I agree with both of what Rachel and Rakana said. Amanda really tailors your hormone therapy to what you need. Everybody's individualized. So my hormone therapy is totally different than theirs. And, being postmenopausal, I just thought that was it. This is how I'm going to live the rest of my life. Feeling like bleh. And
say it again.
It's not true. It's not true.
You're right.
You're right. Hormone therapy, life-changing, game changer. It's just all that it adds up to be. It's true.
It is so exciting to be able to change people's lives in such a positive way. And, it's not like, okay, you have to run a marathon to feel like this, or, you know, you have to go out and, I don't know, get a facelift. I don't know. Something really difficult. It's just one of those things that like just brings the vitality back into you.
1000%. Like, wow. Yeah, it definitely woke everything up.
Yes, it really
Everything.
does. You know, the thing is that I think we have to make sure, I mean, in my age group, I'm gonna say.
We all are. We're in our 50s.
And that's the thing. It's
We're
like,
all in our 50s.
We're all in our 50s, and we really don't think about it. That at some point, you know, in my late 40s, you know, I was like, you know, you don't feel the same. You really don't. But all of a sudden, when you get the hormone therapy, it's like, oh my, it's like an eye-opening experience. Something new and really exciting happens, and you're like, this is how I need to feel. This is how I want to feel. And it was, yes, this is how I used to feel. And it's not like you're doing something weird or different. It's just going back to the basics where you just felt more energized, healthier,
Happier,
sexier, and all of that. And I mean, like I said, the libido. So that's something.
Definitely does help with that.
I always tell people, if you went to bed at 35 and you woke up at 50, you'd be like, oh my God, what has happened?
Exactly. That's exactly it.
But the 15 years intervening, you just gradually, things happen, and I hear it all the time. I just figured, well, I'm getting older, this is how I'm going to feel. Well, you don't have to. And it's not just hormones, it's so many things. It's drinking water, it's getting good sleep, it's having great relationships, it's being happy in your life. But hormones definitely can help with that, for sure.
I will say, when I first started to experience the menopause symptoms, I have always, you know, we all battle with mood swings and some seasonal depression, or, you know, whatever you're going through. But in this moment in my life, I could not pull myself out of it. And it had been a whole year and a half of me not wanting to leave the house. It was during COVID, so it was very easy also to have to adjust to that, make you just feel closed off. And then I just couldn't get happy. And, you know, my doctor offered antidepressants, and I was like, I've never had to take those. I don't want those. That's not, I feel like it's hormonal. It has to be, because this is the only time in my life I have not been able to wake up and be my normal self. And everybody knows here, I am like the skip to my little girl all the time. So as soon as the hormones started, it was within 2 days, I believe, for me. I was just like, I already started to feel it. And within the first week, I came in here and I was just so excited to tell Amanda how much better that I felt. And this is something that has changed over the years. It's not like they used to say, high estrogen, breast cancer. It's not like that anymore.
A lot of those were synthetics too, which we don't use any synthetics here at all. I don't even do testosterone cypionate for that reason. It's a synthetic and it has a lot of side effects. So even though it doesn't have the cancerous side effects, it has other ones that are not amazing. We are not made to have synthetics inside of us. We are made of human, and we need to have human-like things in us and around us.
I have a lot of guys who ask me, what's the difference between the shot and the pellets?
Oh, okay.
Because I get that a lot, because I tell them about it and they're like, what's the difference?
Me too. I get that question a lot as well. So the big difference is that pellets are bioidentical, so same molecular structure as what you currently have or had, and testosterone cypionate is a synthetic. And so it will give you the benefits. It'll give you one benefit of testosterone replacement, and that is to have an erection and have libido. It does not do all the other protective things that bioidentical testosterone does. So heart disease protection, Alzheimer's, bone mass, all of that, it is not as effective. And it does have the side effect of, over time, you will build up hemoglobin and hematocrit and need therapeutic blood draws to draw that off, or you'll have an increased risk of heart attack and stroke. And so this is why I don't use those, because that is going to happen, and it's totally a manageable side effect. But I just feel like if we're going to be replacing hormones and we're going to be making people feel better, let's not try to give them manageable side effects. Let's do things that make people feel good, that don't require monthly blood draws.
Right.
That makes sense. And there's one more thing that I forgot to add. So that little tummy thing that we guys have, after the hormone therapy, mine went away, because we talked about it, you know, and I was like, oh, I mean, I'm not overweight, but that little thing was always there. But then as soon as we started the therapy,
The pooch?
yeah, and it was weird, because I mean, everything everywhere else is like, but it was just that little part, and I was like, what is going on? And then as soon as we started, it obviously not overnight, but over months, it just slowly like dissolved, and I'm like, oh wow, that's. Honestly, I thought you were joking when you said it was going to go away. But then I saw it, I was like, okay, she was right.
Love that.
Hormone imbalance can cause that little belly chub. And then, and more so in men than women, you can have metabolic disturbances. And so metabolic syndrome is high blood pressure, high cholesterol, diabetes. And mainly that starts from having low testosterone because it impacts all of those systems. And one of the hallmarks of that is having that kind of belly. And so it all starts with hormones, hormone imbalance, hormone absence. And so getting hormones back into place just gives you better muscles, better body composition, everything. And obviously when you feel better, then you want to exercise more, which then increases everything. It's just like a like starting point that just keeps going and going and giving and then who doesn't want to feel amazing?
Yes. Especially in your 50s.
Yes.
And 60s and 70s and 90s and 100s and all of the years.
Forever.
Oh my gosh. Drop us any questions, comments. We are thrilled to answer. See you later.
Bye-bye.
Bye.